Hello, everyone. Welcome to another edition of For the Health of It, a new segment on health and wellness dedicated to getting important health information out to you and to our community. I am Dr. Trevor Kinlock, pastor of the Metropolitan Seventh-day Adventist Church, and today we have a very important topic that we want to talk to you about, we want to share with you, and that is on recovering and walking through grief, recovering from grief. And we have a very special guest today that has joined us. That is none other than Miss Janine Jones. Miss Janine Jones is the bereavement coordinator at Holy Cross Hospice, and she works with her master's in counseling psychology. Janine, it is great to have you here today.
Well, it's an honor to be here. Thank you.
Thank you so much. Well, listen, let's get right into it, Janine. This has, of course, these past 2 years in particular have been extremely difficult for obvious reasons, this pandemic. And we know that people of color have been disproportionately impacted with regard to loss. I think we all know somebody that has lost their life to COVID-19 or certainly to any other types of loss. So grief is something that is very real to us. But can you talk to us, Janine, just what is grief? Let's start there. What is grief?
Well, to simplify it, grief is the other side of love. We grieve because we lost something that we loved, we were attached to.
Hmm.
And grief, on a more clinical terminology, is the internal workings that someone feels when they lose something.
Hmm.
Mourning is the external expression of your grief, but grief
Hmm.
is internal.
Okay. So grief is that internal sense of loss that we feel.
Yes.
Okay. Okay.
And,
Yeah.
and And one thing that I try to share with family members, grief is a reflection of the relationship. So if grandma passed away and, you may be crying, but your brother may not be showing that same level of intensity, it doesn't mean that he's not grieving. It just means the relationship was different
Hmm.
between, you and your grandmother and your brother and your grandmother. And then also,
Hmm.
too, the personalities. Each of us grieve differently.
Yeah.
So I try to remind people that please don't compare your grief to a family member because it's
Hmm.
about that relationship that person had with that individual who passed away.
Absolutely. So everyone grieves differently. So understanding and giving people the space to grieve in the way that is best for them that they need to.
Hmm. Yes, that's
Okay.
very important.
Hmm. Okay. So with regard to grief, if you've been introduced or experienced grief perhaps for the first time, and
Mhm.
perhaps for some for more than once, there is this sense of being rocked and jolted, like your whole world being kind of spun around,
Mhm.
by this very traumatic event. When does that end? When does grief end? There's a sense of, is there a beginning and an end to the grief process? Can you talk to us about that?
Okay, well, there is really no time limit to grief because grief changes who you are as a person and it becomes a part of who you are. However, there are different phases of grief. And
Hmm.
like you said, you have that initial shock where the reality that your loved one is not there and based on the way that they passed, some
Hmm.
people it's a sudden death where it was unexpected. It could
Yeah.
be a prolonged death where you're experiencing anticipatory grief. But either way, you have that shock because the person is no longer there.
Hmm.
And then you go through the accepting the reality that this person is not going to be here.
Hmm.
You go through that, and then the processing the actual grief. And I tell people that's the hard part. That's where
Hmm.
you have to like take the clothes out of the closet. You have to change the bank accounts, things like that. And that's really a hard thing to deal with. And then one of the things that we don't really talk about a lot is adjusting to the world without your loved one.
Hmm.
And that's where you experience those secondary losses.
Hmm.
Who am I now? If
Right.
it was a spousal loss, am I still a wife or am I still a husband? One thing that I find with child loss, mothers, they grapple with the fact that, I had three children, now I only have two. Do I tell other people about my third child? So those are
Hmm.
things that you have to deal with. And then the fourth one is um, remembering my loved one. Do I pretend that they're not here, or do I find something that will keep their memory alive? And
Mm-hmm.
and so those are kind of like the four stages that you go through. Now, again, I always want to put this disclaimer out because the popular notion is Dr. Kubler-Ross is the
Mm-hmm.
5 stages of grief. And if you read her literature, that was really for the dying. That's for someone
Mm-hmm.
who's actually dying.
Okay.
So that's why sometimes you see people are like, well, I went through denial, and when am I going to go through anger?
Mm-hmm.
And grief is different from that. That's what a person who's actually with a terminal illness goes through. So
Mm-hmm.
grief is a little different than that. It's more of phases.
Wow.
Yeah.
Wow. Thank you for clarifying. I think
Mhm.
that that's useful, and that's important to clarify the difference between those who are actually going through the process of death or dying themselves versus those who are walking through that with someone who has died.
Yes, yes, and it is different. And I try to remind people that grief comes in waves, because you might be okay one day, not okay the
Mm-hmm.
next.
Mm-hmm.
Okay,
Okay.
1 month, not okay the next, and you're like, oh, am I going back? No, that's just how grief is. It goes up
Right.
and down.
Okay. Okay. All right. So that is very much normal with grief. So that leads me to my next question. Then
Mhm,
help us out, Janine.
mhm.
Um, can I end my grief sooner? How can I end my grief sooner?
Well, there's really no ending your grief sooner, but there are things that you can do to help with those different phases.
Mm-hmm.
You can, like, and I can go back to one of the models that we use at the center is Dr. Woodland's 4 tasks a morning. And
Mm-hmm.
like with accepting the reality of the loss, there's some internal questions you can ask yourself. Like, am I truly accepting the loss? Am I denying it? Am I in denial, or have I
Mm-hmm.
truly accepted it? Another thing that we do, especially people of color, we are very resilient, and we tell ourselves, I got this, I'm good. But one thing, in order for you to heal, you have to feel. So
Mm-hmm.
when you feel those intense emotions, allow it to come through you.
Mm-hmm.
A lot of times we want to suppress it, we want to act like we're okay, but it's okay to cry, it's okay to feel anger,
Mm-hmm.
to allow those things to process. And then also to be honest with who you are, because you're changed now. So it don't go back to trying to be the person you were before you lost your loved one. Accept the
Mm-hmm.
fact that I'm a different person now. And what does that look like?
Mm-hmm.
And then the final thing, which I think is so important, especially for Christians, is to know that everyone's life mattered, whether it was long or short,
Right.
and trying to find that legacy of love
Mm-hmm.
that your loved one left, and
Yeah.
what lessons that you can take into your new life, because you
Yeah.
are going to be different.
That's powerful. That's powerful. That finding that legacy of what?
Love, legacy of love.
Mm-hmm. Mm-hmm.
Mhm.
All right. That certainly helps process it and helps you to
Mhm.
kind of reorient your mind toward the loss and then how to move forward.
Yes, but know that you're forever changed.
Mm-hmm.
You're a different person.
Yeah, yeah. Okay. You talked about the different ways to grieve.
Mhm.
I haven't cried yet. Is there something wrong with me? Someone may be asking that question. How would you speak to them, Janine?
Well, and again, I talked to a young lady today. She lost her father yesterday,
Mm-hmm.
and that was one of her questions: is I haven't cried yet. And a lot of times, based upon the relationship we had with that person,
Mm-hmm.
we might not be ready to cry. It might be some anger, it might be some disappointment.
Yeah.
So I told her it's still okay to grieve. Your grief may be anger, or your grief may be disappointment, but take time to consciously think about your loved one and think about that relationship. So you may not be at the point where tears are there, but
Mm-hmm.
whatever feeling that you're feeling, go ahead and allow yourself to feel that. And
Okay.
it's normal, because relationships have their ups and downs,
Mm-hmm.
and grief reflects that.
Okay. So even if the tears aren't coming, still take the time to allow myself to feel
Yeah.
the disappointment, the pain that I'm feeling as a result of grief.
Yes, because sometimes we grieve the loss of what we wanted that person to be in our life.
Mm-hmm.
And so in this particular situation, she was angry because her father was not the person she wanted. So there
Mm-hmm.
was that anger. So she is grieving, but right now what she's feeling is anger. So go ahead and be
Okay.
angry.
Okay. Okay. It's okay to be angry.
It's okay to be angry, yes.
Yeah. There are times where you can feel like in the church community, there is the sense of, well, you can't express it, or you certainly should not be angry, but you ought to let those feelings come out. That's what you're saying.
Yes, that's healthy because grief is the other side of love. And
Hmm.
even though people we love, we get upset with. And so if we lose them, we will still have those
Hmm.
emotions,
Hmm.
especially if there was a rift or if there was a strainment or something complicated in that relationship, you're going to
Right.
be upset or you're going to be
Right.
disappointed. I worked with a young lady who lost her child due to an accident, but he was riding a motorcycle carelessly. And
Hmm.
he leaned back and he accidentally killed himself. So she was
Hmm.
angry that he was not careful, that he didn't do what he was supposed to do. But she still loved him, but part of her grief was that anger.
Right.
So she had to deal with that. And once she dealt with that, then the other emotions were allowed to come up.
Okay. All right. Got to deal with it. Got to give yourself that permission to feel. Got to allow yourself to feel
Mhm,
those emotions.
mhm,
Janine, this is so good. Thank you so much. I know that this is extremely helpful to
mhm,
someone that is out there. And as a matter of fact, if you know anyone that is out there that needs to get this message, please share this with them.
mhm,
We're going to come back in our next segment and do some follow up conversation on grief. We're going to have Janine with us again. Janine, thank you so much for coming today and
mhm.
sharing this information with our audience. And I want to thank all of you for watching us today, for watching another edition of For the Health of It. If you know that this has helped you or been beneficial to you or can be for someone that you love, please like, please share, please subscribe, follow us on Facebook and YouTube. And we just want you to remember God wants you to be prosperous and in good health. So
Amen.
let's take care of ourselves so that we can live our best lives. Thank you, everybody, for watching. God bless you, and we will see you next time.